And then when you switch to...
Good afternoon, everybody, and thank you so much for joining us for today's session. We're very, very excited to share with you what's coming up. This is not a typical Grand Round session, but instead one focused on wellness. So while we have had some sessions with speakers coming in addressing aspects of wellness, this is all wellness all the time for the next hour. So I think you're in for a real treat. I'm going to open with some housekeeping, and then I'll introduce today's speakers. A couple of things. For those of you who are here in the room, we would welcome discussion at the end of today's session, and there are microphones stationed in a couple of places throughout the room. We just ask that when you're preparing to ask your question, you position yourself in front of the microphone so that the attendees online can hear you. If you're online, we welcome your questions in the Q&A, and you're welcome to input those at any time during the course of the session, and then I will moderate discussion at the end of it. Last but not least, we would welcome your feedback both about today's session and about rounds in general. That feedback will be available to you via a survey. There's a QR code that will pop up here if you're in the room. It will also come up on screen at the end of today's session and be sent to those of you who are registered online with a link to complete that evaluation. Did I forget anything? Okay, great. So it gives me tremendous pleasure to introduce today's speaker team, starting with Dr. Craig Rooney, who I just realized you have another first name. Yeah, it's an S. I don't know what it stands for. Stephen with a PH, and you have a PhD. It's so fancy. Look at what I did there. Okay. This is the most fun I have all week. This is all I don't get out much. Dr. Rooney joined URMC as its inaugural Chief Wellbeing Officer in February of 2024, which to many of us really feels like a true testament to the institution's vision around wellness and well-being. Not just his selection, but the creation of the role, but also his selection. Prior to joining us, he served for 4.5 years as Director of Psychological Services and Wellbeing for the MU School of Medicine and MU Healthcare, working in partnership with others, including its CWO, to establish a robust program. Before that, he was Assistant Director of the MU Counseling Center and of Mental Health Services at the Student Health Center. He earned his PhD in Counseling Psychology from the University of Missouri-Columbia in the year 2000, completed his internship in psychology at the University of Utah Counseling Center in Salt Lake, and has published and lectured on well-being and related topics nationally and is involved in national collaborative networks on healthcare worker well-being. He also happens to have an appointment here in our department, as well as the Department of Family Medicine. Dr. Autumn Gallegos, seated to my right, is Associate Professor of Psychiatry and a licensed clinical psychologist. She is our departmental wellness officer, primarily addressing faculty, but it's really a partnership between the two of you, which I'll talk about Itza in just a little bit. But for those of you who don't know, Dr. Gallegos has also had an extensive research career exploring the effects of mind-body interventions on PTSD and post-traumatic stress symptoms among survivors of trauma. She's an experienced mindfulness-based stress reduction instructor and teaches courses to faculty and staff at the university. She received her PhD in clinical psychology from Fuller Graduate School of Psychology and completed predoctoral and postdoctoral work here as part of the PRIDE program. Last but not least, Itza Morales is a graduate of the U of R for her bachelor's degree in the Simon School of Business. What's an MSB?
Masters in Business.
Masters in Business in Health Administration. Not to be confused with an MBA. I think Itza is awesome. Itza is one of my all-time favorite people. A native of Puerto Rico, she has over 33 years of experience working in the fields of mental health and substance use disorders. Her experience includes research, direct patient care, and administrative roles. Currently, Itza is the Senior Director of Operations overseeing 4 licensed clinics under addiction psychiatry. She's a pilot project lead for one of the URMC Recovery Center of Excellence projects and is our Department of Psychiatry Staff Wellness Officer. She's worked for Strong Recovery since 2008 and is deeply committed to the SUD field as well as staff wellness. She is the kind of person, she said in her own bio, but I can attest to this, who sees current challenges as opportunities to improve the landscape, not only for patients and communities we serve, but as well as for all of us. Did I miss anything?
That was very thorough.
All right, great. Well, we have an illustrious team, so without further ado, let me hand it over. Thank you so much. Okay.
Thank you, Dr. Rosenberg. Yes, as Dr. Rosenberg said, you'll hear from your well-being officers for the department. I'm also so grateful that Dr. Craig Rooney is joining us as our university's first chief well-being officer, as aforementioned, and all the exciting work that's being done in the Office of Wellbeing. And your well-being officers will review the various efforts and opportunities to support well-being among faculty, staff, and learners. Of course, this is honestly an incredibly difficult time for us in healthcare. And we're constantly inundated with news of uncertainty, of change, that perhaps can take away from our sense of our capacity to do the work we came to do, and our meaning in the work that we do. And I appreciate Dr. Lee's perspective of this really being a time for opportunity. And I've also observed something. I've observed that we're, as a collective, of people who pay attention. And whether it's attention to our patients as clinicians, you know, sitting with someone who's hurting, we're paying attention. Or paying attention to a gap in research, like making sure that folks aren't lonely anymore, or trying to reduce suicide. Gaps in clinical care, like making sure that our inpatient folks have access to the outside, or something like Brighter Days Clinic, right? And myths. I'm really honestly inspired and grateful to work with each of you and to hear all the various ways that you pay attention and you act. And as a mindfulness researcher and teacher, I think about the importance of quality and attention a lot. So it feels particularly meaningful to think of myself as walking through and getting to work with each of you every day. And if, like Simone Weil says, attention is the rarest and purest form of generosity, then perhaps we're a very generous people. And I feel grateful for that. So if you would be willing to join me for a moment to perhaps bring to mind something that you're grateful for this community that we work in. I'll give us a moment. The generous people also need their well-being supported. Our mission as well-being officers is to support and cultivate a workplace that enhances our professional fulfillment and our compassion toward one another. There's so much well-being effort that is already woven into the fabric of our culture as a department, whether it's through mentorship, through training and education, through retreats that different divisions do, through leadership behaviors. So there's a lot of opportunity to support things that are going well. And of course, we also want to support and envision new ways to build well-being into our culture. And so to date, we've looked into ways to build that in through appreciation efforts, through community building efforts, and through education and training. So there's a lot of work, of course, to be done. And we're really looking to co-create this with each of you because we're a really big department. And there's a lot of exciting work already being done. And of course, a lot of work that needs to be done. So it's important to also align ourselves with evidence-based work that's happening across the country. This is a recent publication from the Mayo Clinic, really looking at ways to embed well-being through 5 key strategic focus areas. And I think it's important for us to look at how we align here. And, for example, they talk about building a healthy work environment, a place where folks feel physically and psychologically safe. Building personal enrichment. How well do you connect to the values of the department that you're in? Are you supported in your career to grow? Do you have community at work? Do you feel a sense of belonging? Do you feel valued and appreciated? Do you feel like your work is meaningful? So these are some key areas that I think is important for us to see how well do we align. And one way that we do that is with our well-being survey that hits on several of these concepts. And I wanted to take some time to review the last 3 surveys that we've done. It was initially started in 2020 just to see how folks were doing in the context of COVID stressors. And it was initially started annually, and then the evidence really is to do that, to do them biannually. So we'll have one coming up in the fall. We've had a really good response rate, about 50%, that pretty much reflects a national average, and in some ways is better. And of course, we would love to see more participation. I think it's important that you all know how this information is used. We emphasize the anonymity of it. And also it's an opportunity to share ideas and again, co-generate ideas for improvement. Well-being work is certainly not done in isolation. And there's so many people doing so much amazing work all the time. But we have key stakeholders that I've shared the results with over the years, primarily chairs, division chiefs, and most recently ambulatory leadership. And identifying more and more key stakeholders is a goal of mine to make sure that this information is disseminated. And I always provide key takeaways and opportunities that again is really co-generated. The survey goes through several elements. One is a single item mini-Z survey that asks about job satisfaction. And the other is the Stanford Professional Fulfillment Index. And that looks at both fulfillment, so that intrinsic reward from the work that you do, and burnout, that exhaustion and disengagement. So respondents can indicate rates of both fulfillment and burnout. And you'll see that in the results that some folks report being both burned out and fulfilled, and perhaps, or I shouldn't say burned out, but have indicate burnout. Or some folks indicate being all fulfilled and no burnout. So you'll see how that plays out. We also look at drivers of fulfillment and burnout. This is where I get the most information that's really helpful when I'm sharing with leadership. Ideas for improvement, and then qualitative ideas. Folks have been really generous in sharing ideas for their improvement as well. And this can be broken down for faculty, staff, for folks who are patient-facing or not, and then by division. And today I'll just be sharing results from all respondents. So you'll see for the last couple surveys, folks who strongly agreed that they're satisfied with their job stayed about the same, about 67%. And folks who disagreed with that statement were about 15%. This will give us a little more information where we see, using the Professional Fulfillment Index, that our rates of burnout, or folks indicating that they experience burnout from the questions from the Professional Fulfillment Index, hovers about 40%. That's, and it's similar between 2021 and 2023. It's a little less than the national average, but it looks different from division to division and between faculty and staff and those that are patient-facing. And then those that are expressing no burnout, it's about 60%. And then folks who are describing experiencing fulfillment and no burnout, it's about 31%. And then we look at these drivers. What's actually driving these numbers? And I find this really interesting. We look at workload and job demands. Do you have the time to accomplish expected output with the support provided? Do you have control and flexibility? Do you have work-life integration? So that's a different way of saying work-life balance, which often conveys that there's supposed to be a balance here. This is really saying, do you have the flexibility to pursue your personal and professional ambitions? We look at social support and community, efficiency and resources. Do you have the resources to accomplish the goals of your work? Do you align with the organizational culture, and do you feel recognized for the work that you do? So in terms of all respondents, the higher the number, the more that indicates professional fulfillment, the lower the number is indicating rates of burnout. So folks who are indicating rates of fulfillment across the board are really saying that social support and community at work is really driving a sense of fulfillment in the work that we do. And that workload and job demands is driving experiences of burnout. And you see that more with folks who describe being burned out versus folks who say that they don't have burnout. In terms of how the data is used, again, this is a co-generative process in which I'm looking at the results based on a lot of different factors in terms of demographics. Again, that's where you work, whether or not you see patients, whether or not you're faculty or staff. I'm looking at those primary drivers of fulfillment. Can you capitalize on things that are going well? Primary drivers of burnout. What needs to be changed to help prevent folks from, to allow folks to keep doing the work that they want to do? And what are particular goals? So an actionable item might be, for example, a quarterly division leadership meeting where you focus on providing updates and accolades to the folks in your division, for example. And leadership has been really responsive, and some folks already have a lot of these things already going on. And so again, it is a co-generative process. And as I said before, identifying folks who really want to be considered key stakeholders or who are key stakeholders is a goal for the future. But one thing that really came out is that social support is incredibly beneficial for folks. And we wanted to help build upon that sense of belonging, especially as we keep growing and keep building ourselves as a department. So we implemented the new faculty orientation a few years ago. That's an opportunity for new faculty to learn about the history of our department, to learn about the various efforts of the divisions. And we hear the important work of the faculty support office as well. And we learn about Rochester and our place here. I also implemented what we call third place groups. This is something that Stanford and the Mayo Clinic have done by different names. First place being your home, second place being work, a third place being where folks gather, whether it's a park or a restaurant or a coffee shop. And so we've had opportunity to help folks gather and build community that way. So we want to continue to look for creative ways to build community. We want to think of important ways to help allow folks to continue to do the important, generous work that you do. In the future, something I'm building right now is a wellbeing curriculum for trainees. And we'll continue to do the biannual survey and improve that, get more useful information for folks. But again, there's so much amazing work already being done and amazing ideas that you all have. Please don't hesitate to reach out to me, to Itza, to your WellU champions, to let us know how we can support you and ideas that you might have for improving well-being. So thank you. I'm looking forward to hearing from Itza as well.
It's a tough act to follow. I don't have surveys and graphs and all of that, but I do have an update from your staff wellness officer. And I do apologize because I know that I am sporting today my Kathleen Turner voice. I am getting over a cold. And I keep thinking every time I hear somebody cough, I'm like, I forgot my cough drops. So I'm hoping somebody can maybe give me some cough drops if I start hacking up a lung. But anyway, who am I? I think, oops, going the wrong way. I already started wrong. So thank you, Sapporo, because you introduced me so nicely, but I have been the staff wellness officer for the Department of Psychiatry since just January of 2024. And I had to fact check that with myself because in many ways, I feel like I've been doing this for a long time. But it's been since January. But before that, I was a WellU champion for Strong Recovery, which is one of the clinics under addiction psychiatry. And I help support approximately 522 staff members. So that's a lot of people for just me. I also am the Senior Director of Clinical Operations for 4 licensed clinics. And I am the project lead in one of our projects for Recovery Center of Excellence, Welcoming Stigma. So I say all of this because the truth is I need the support from all of you, right, in order to really create opportunity for well-being in the workplace. I can't do it alone. I can meet with you. I can have some creative ideas. I can try to get funding for wellness rooms, although funding is a word right now, right? Because we're all experiencing those financial challenges as well. But I can help to support you. But it's really the commitment that each and every one of you has to kind of creating a workplace that makes sense, right? My mission, and I'm putting this in quotes because this was actually part of the email that Patrick Such sent out when he introduced me to the department. And it said to partner with the wonderful Autumn Gallegos, Faculty Wellness Officer, to promote and implement wellness initiatives throughout the department and make ongoing wellness a consistent part of the fabric of our work environment. And I am very much committed to that. At one point, Dr. Lee said, I want you to be the champion of champions. I wasn't quite sure what that meant. But I think that for me, I'm committed to try to encourage as many of you as possible to become WellU champions. How many people here are WellU champions in your areas? Anna. All right, so we got some work to do, right? When I first started in January, I really didn't know where to get started. So I sent out an email and invited people to connect with me and just tell me what they felt wellness or well-being looked like in their areas. I got to meet with some awesome WellU champions that were already initiating things in their workplace, in their clinics or offices, and shared with me their successes. I also got to meet with WellU champions that had a hard time engaging their colleagues and doing challenges through WellU. You know, and some people that really had no connection to a WellU champion or any wellness initiatives and expressed some frustration about that. Some common themes last year were around CPM, which almost feels like something of the past right now with all the with the current challenges that we are experiencing now. Not enough time to promote wellness activities, right? Everybody's too busy. But it's about, you know, creating time for these things or prioritizing our well-being in the workplace. Not enough support or protected time or resources. And existing WellU champions have problems engaging staff in WellU challenges or no champions, like I said earlier. Now, the CPM concerns were a big concern to me, and partly because I am in a role of leadership, I wanted to better understand what these changes were about and how it was impacting our staff, because I was tasked with helping people understand and also advocating for themselves. So Patrick Such and Kathleen Maurer, who was our HR business partner, agreed to host a couple of town halls. And I felt that was really important to do because I wanted the department to actually encourage people to talk about what their concerns were and also to have a level of transparency. What CPM meant, what the salary changes meant, the classifications all of that, to work through it together. Because again, we are part of a big enterprise, and sometimes these changes just don't translate well to the Department of Psychiatry, because we have so much else. We're such caregivers that we have a lot of things that we need to get done and accomplished. And sometimes when these changes are coming, it just feels like they're just on top of us. So there were 2 town halls. June of 2024 was the first one, which was Patrick and Kathleen Maurer. And out of that, there was a lot of feedback that people really felt like they weren't heard, or there wasn't a lot of opportunity to be heard. So then the decision was made to host another one in September 2024. Ashley Negron from Human Resources came, and there we had more of an opportunity to ask questions of her. And I'm hopeful that, although 100% of things weren't clarified, people didn't walk out with warm fuzzies, but at least there was an effort to try to explain what was going on. All right, now I'm going to shift to WellU champions and why I think they're so important in our workplace. First of all, they advocate for wellness at work. So they really have this firm belief that we spend so much time at work that we should create an environment where we feel a sense of belonging. I've asked for ideas, initiatives, and feedback from them as well. And then to promote wellness events through WellU, which is a great resource, by the way. But I'm not going to get into that. They have their own spiel. What my goal was to increase WellU champions in the department, and now currently we're at 25 that I know of, and I'm constantly asking, if you're a WellU champion or you're interested in being one, please reach out. It's really simple to do. And I could either meet with you individually or just send you an email with instructions. But we need to continue building our well-being leaders. And leaders in the department need to make sure that you are creating space for that from your staff and creating opportunity for them to have some protected time towards, because it's an asset and it's needed. So I am not going to read through this long list, and these are in alphabetical order, but these are our current WellU champions, again, that I have knowledge of. And I also know of a lot of people that champion wellness initiatives that aren't technically WellU champions. One of the questions that I get is whether or not there can be more than one WellU champion. And the answer is yes. Actually, the more you have in your area, you feel a sense of partnership with that person. And then you can, kind of deliver to your areas different challenges. And it doesn't just have to be WellU champion challenges. All right, I'm starting to lose my voice here. What we've done for WellU champions in the last year, well, we had a breakfast that Autumn and I hosted, as well as a WellU appreciation lunch at Grappa's, which was well attended, and we appreciate all of those that attended. First, we're also having a Sea Breeze picnic on January 7th, so I'm hopeful that you got your tickets and that you will join us. I am praying to the sun gods that it's a beautiful, perfect weather day, not too hot, not too chilly, and definitely no rain, so that we can all enjoy it. Future goals, well, I want to mirror what Autumn has done so well, which is create new staff orientation. She has the new faculty one, but Patrick, Kathleen, and I are committed to starting a new staff orientation where when people join the department, they can hear more about the history and learn about the different divisions. Also, there's been an ask for a recognition party. So hopefully we can still do that. That is my hope. So I want to thank all of you for listening to my spiel today. I feel like I was just the commercial break between Autumn and the great Dr. Rooney, who's going to present to us right after. And again, I welcome you to reach out to me telephone, email, Teams message. I'm happy to meet with you. Thank you.
Good afternoon. I'm going to raise this up a little bit. Can everyone hear me okay? So last night, I don't usually have such kind of linear, literal dreams, but I dreamt I was doing grand rounds with Autumn and Itza. We were outside for some reason. It was a dream, but my slides were just a jumbled mess. My notes were a mess, and then it started raining. So everybody say a little prayer for me. That goes a little better than that. So I'm proud to call Psychiatry my primary academic home. It's a pleasure to be with you today. It's a pleasure to work with both of these extraordinary people that we have in our department. Today, I just want to provide you with a brief update about the first year of the Office of Wellbeing. But to set the table, it's important to say that URMC has had a decade of work in the clinician wellbeing space, spearheaded by Dr. Mike Privatera, who was also from our department. With the addition of a CWO, our office was scoped to embrace the workplace well-being of all faculty, staff, and learners. And so that's a big task. And so our first step of first order of business was to build a leadership team to take on this massive challenge. Dr. Jessica Shand continued Mike's legacy for several years, and she continues to provide leadership for the Office of Wellbeing as our Associate Chief Wellbeing Officer. Jessica's broadly talented for any of you who know her and provides expertise across a wide spectrum of our initiatives and stakeholder areas. Tony Sexton is our operational expert who keeps our projects on track and our finances in order. And her background with both administrative excellence and education makes her a particularly helpful thought partner with regards to operations and programming. Autumn is providing us with measurement expertise and keeping us abreast of emerging research. And she's played a huge role in the development of reports for the Wellbeing Index for the entire institution, and will play a huge role in the related consultative follow-ups. And she is also assisting many grant winners, which I'll talk about here in a little bit, with a measurement strategy to track the effectiveness of their interventions. And then Itza Doherty is our glue that holds it together. It's important to start with my team because no leader accomplishes anything without a team. And I'm really proud of this extraordinary group of people we've assembled to launch the new Office of Wellbeing. So occupational distress is driven by many factors. Big ones are organizational factors like administrative burdens, workload, and job demands, lack of control over work environments, systemic factors such as reimbursement models and regulatory requirements, interpersonal factors like difficult patients and patient families, bad leadership, toxic team dynamics, erosion of meaningful connection and a sense of community, and then individual factors like coping skills, resilience, and values alignment. So during this first year, my team and I wanted to develop working vision and mission statements that aligned our work with the strategic plans of both the university and URMC, and that allowed us to pursue these major drivers of occupational distress. So informed by Dr. Shand's and my own professional experiences, our listening tour, and several years of longitudinal data from the Wellbeing Index, which I'll just say WBI, it's a validated global measure of well-being. We developed 4 strategic areas to guide us through the first phase of the OWB startup. OWB being Office of Wellbeing. Somebody yell out if I just am throwing all these initials out. So our first strategic goal to make data that's of the highest quality, that's accessible and actionable about well-being across the institution. Undertake continual improvement of a portfolio of programs and services that provide educational and practical tools to enhance well-being. Third, develop opportunities to enhance workplace support and to strengthen employee and learner connectedness. You had heard that Autumn mentioned earlier from her data that kind of connection is a real driver for those who are satisfied or professionally fulfilled. And then finally, attempting to develop a comprehensive communication strategy that influences a culture of well-being by advancing a dialogue that keeps well-being front of mind and that reinforces a shared understanding of our well-being strategy. So getting the structure in place so we could begin to focus on processes was not always visible, but it was critical to guide our work. And so now I'd just like to highlight some of the accomplishments we've achieved and about which I'm really proud, and I hope that you will be too. So the first thing our office did was to develop an intranet page to centralize well-being communication and pull together the key individual wellness services that are available to our workforce. URMC has an abundance of resources available, and while my office administers none of them, we do consider it a key responsibility of ours to amplify these services and to destigmatize their use. And so now through the intranet page, our workforce has these resources at their fingertips in one easy to access digital location. We have just transformed the intranet page into an external website so we can tell the world how much URMC is focused on workplace well-being. You know, we know from numerous survey data that many people are looking for employers and educational institutions that they perceive as caring about them. And so the risk of not having a successful enterprise-wide well-being program is directly related to our ability to compete among those employers and educational institutions who are successful in sharing this narrative of caring. So we are attempting to position URMC to better share our story so we can even leverage well-being as a competitive advantage in recruitment and retention. Really, the marquee program of my vision for URMC was the creation of the Wellbeing Fellows program. And Jessica Shan developed that curriculum, and our team launched this program in January with a cohort of 13 individuals who are leading well-being initiatives in their local environments. Now, not all 13 are pictured here, but you can check out the full cohort at the new website I was just telling you about. The Wellbeing Fellows program is modeled after a nationally recognized initiative. In short, it provides professional development for those working in well-being so they gain knowledge in a broad spectrum of areas like well-being science, dynamic improvement methodology, change management, finances, and working with leadership. It's a year-long project-based learning experience with a lot of scaffolding and support. In addition to including clinical medicine faculty, Wellbeing Fellows represents innovation to that nationally recognized model by broadening our focus beyond physicians to include research faculty, a pharmacist, a psychologist, a nurse educator, and an APP. So at the end of this calendar year, we will be holding a Wellbeing Symposium that will feature a keynote speaker who is an international well-being thought leader. I'll just leave that as a little crumb of a teaser until we get the contract signed. But more importantly than that is that we're providing our cohort with an opportunity to share about the projects that they will have been working on all year in their local environments because they were in this program. So there's the save the date for Thursday, November 13th for this event. In February, we launched an enterprise-wide well-being mini grants program open to all faculty, staff, and learners at URMC. The mini grants provide financial awards to the top scored applicants so they can deploy a well-being intervention in their local environments. So in addition to providing us with more internal environmental analysis of pain points and the solutions those closest to those pain points thought could be helpful, it was our hope that this would generate interest in the well-being area and increase morale. We were thrilled to find out that we received over 150 applications. And I wish we could have funded all of them. This was such an inspiring project to be a part of, to read all these, to see how many people really care about workplace well-being and wanted to make improvements in their areas. We utilized an independent scoring committee to determine which mini grants were funded. It was comprised of 6 individuals who broadly represented the organization, from clinical medicine to professional nursing, school of medicine and dentistry, HR, patient experience, and research. And that committee selected 12 project winners, 3 of whom are from the Department of Psychiatry. So congratulations to EAP, Inpatient Psychiatry, and the Mobile Crisis Unit. Yeah. And we're looking forward to sharing their stories as they work on their projects over the next few months. Grant offers have also gone out to, I just wanted to kind of list them off to show the kind of breadth of the organization we were able to reach. The Community Center for Community Health and Prevention, the Perioperative Service Line, the Institute for Innovative Education, School of Nursing Central Administration, the NICU, Chaplaincy Services, the Advanced Heart Failure Clinic, the Department of Urology, and one of our residency teams. And then through this, we were also able to identify 7 quick fixes also across a wide spectrum of locations and services. And so this really, again, helped us kind of receive that internal environmental analysis data about the pain points and types of interventions folks were interested in. And you can kind of see this there. This shows that people really hunger again for that meaningful connection with coworkers and colleagues. And we've taken this feedback to leadership, and we will continue to seek ways this year to provide more opportunities for social connection. Second, a lot of folks were interested in spaces. Capital improvements is a separate kind of funding stream, so we weren't able to get to those through mini grants, but folks were interested in the importance of space for respite, exercise, and quiet. We know professional development tends to enhance well-being, and it is perhaps a primary determinant for a number of people, and we continue to see a lot of interest in retreats and wellness fairs. So these takeaways will help us plan for future initiatives and also give us advocacy points that the office can work toward when we work with other leaders. So earlier I mentioned the importance of providing quality well-being data to the institution, and I mentioned we've been using the WBI since 2018. This year we tried to improve on that experience. We expanded the WBI to research faculty and postdocs for the first time. We expanded the survey to nurses at all affiliate hospitals for the first time and to APPs at 3 affiliate hospitals. And compared to our 5-year average, we were able to achieve a 97% increase in total faculty participation, including a 62% increase in participation of clinical faculty, close to 100% of the research faculty that we invited to take the survey, and a 30% increase in APP participation over the 4-year average. And so some good news is that residents, fellows, and pharmacists are doing quite well, but you can all see the bad news. Our nurses, APPs, and faculty have rates of distress much higher than we would like. And these groups are above the national burnout averages for their occupations. So getting the WBI administered, expanding it to more groups, getting around the institution to drive higher response rates, that was a lot of work. But that, of course, was really the easier parts. We've now built over 50 local reports for leadership and well-being representatives and have invited recipients of every one of those reports to a customized consultation to make sense of these data and develop an action plan for the next year. So we're going to really push hard to have areas use the data to make improvements over the next year. And additionally, because the WBI is not delivered across the entire workforce at URMC, we have partnered with Kathy Gallucci and Human Resources to curate a set of well-being items on the forthcoming employee engagement survey so we can establish a more robust well-being baseline for the rest of our staff. Yeah. We're deploying strategic communications to amplify and celebrate the well-being efforts being made across the enterprise, from a strategic partnership with informatics to a provider education council partnership with learning and development to make mandatory trainings less burdensome, to one of our nursing well-being representatives' efforts to enhance well-being in the NICU. We're trying to help develop a culture of well-being by keeping the conversation at the forefront, from one of Dr. Linehan's first Line to Linehan videos, to reminders of our program launches, to providing coping tools across the entire university. We are reminding the workforce that we care, we're listening, and we are doing. We're utilizing platforms like LinkedIn to share our successes with the nation and our representation among national thought leaders. And we're starting to be noticed as national thought leaders ourselves. Becker's Hospital Review recently highlighted our Wellbeing Fellows program because of its unique interprofessional approach. And we've begun to be noticed by national organizations for our efforts as well. The National Academy of Medicine recently named URMC a change maker for 2025 due to our commitment to improve health worker well-being. And this recognition provides access to other national thought leaders so we can participate in their clearinghouse of effective well-being interventions. Shortly after I arrived, Dr. Andrea Garraway pointed me to a troublesome question on the peer reference form that asked about whether a peer had emotional instability. And this piqued my interest because I had previously worked with Corey Feist, CEO of the Dr. Lorna Breen Heroes Foundation. And my team saw an opportunity since URMC had not yet made credentialing question changes per the foundation's recommendations. So making sure credentialing questions ask about mental health in certain ways, if at all, is important because sadly clinicians have higher suicide rates than the general public. Dr. Lorna Breen was a New York City emergency medicine physician who died by suicide in the early days of the pandemic. This is after she had received psychiatric care, and tragically, she believed that receiving that treatment would end her career. So we sought to change the credentialing questions here at URMC to be aligned with the Dr. Lorna Breen Heroes Foundation so our clinicians would know they could seek help when they need it. And this was a team lift that involved Dr. Mike Apostolakos, the Executive Privilege and Credentials Review Committee, and the Medical Staff Office. It involved multiple iterations over several months, and we got it done. The Dr. Lorna Breen Heroes Foundation recently recognized URMC as a Wellbeing First Champion for 2025 because we made those credentialing question changes so they are not too broad or invasive in asking about mental health treatment. And so this year, as a part of being recognized, we will find multiple ways to communicate this to our clinicians so they know that they will not face questions like these in either the New York State licensing process or the URMC credentialing process. So URMC is now an affirmative part of destigmatizing mental health treatment for our clinicians. And I think this is kind of a big deal. So I'll share just a handful of other accomplishments in year one, and then I'll conclude my update. Dr. Sham was able to partner with Dr. Judy Baumhauer in the Office of Academic Affairs to get rigorous well-being work recognized for promotion and tenure. And the three of us launched a faculty exit interview program to hear about what is driving faculty to leave. We've provided 271 unique consultations about how to address well-being issues in microenvironments and how to integrate well-being measures into the work others are doing. I was selected to attend the Stanford CWO course this summer, which will solidify our access to that community of thought leaders and assist me in maturing our office out of the startup phase. We are presenting at national conferences, and we are developing trusting relationship with key stakeholders to embed well-being considerations into their work and to nurture ongoing meaningful collaborations. So obviously next year, we hope to have metrics from our year one programs that we've launched so we can begin to define outcomes for the organization and for the office. We'll begin to socialize a URMC version of an occupational fulfillment model pioneered by Stanford University to assist the organization in understanding the scope and position of our office. And finally, of course, times are uncertain and we've got to be nimble to change with them. We will continue to listen so we can be the most relevant and the most responsive during these times. So through it all, my promise to you is I'm going to do everything I can to remain an optimist. And that's for a couple of reasons. I don't think a chief well-being officer full of resignation and defeat would be much help to the organization. But I also think in academic health, we already have one of the most resilient workforces in the world and among the smartest and most innovative. And so I really am a firm believer that we will face these challenges together. Thank you.
I would love just to start with an expression of gratitude to the three of you. So we're going to open with gratitude and close with gratitude. But to say thank you to each of you, not only for your updates, but also for your investment in our local community here in the Department of Psychiatry at the staff and faculty levels, but as well as institutionally, we're very grateful. And I feel like we've got pretty decent representation of psychiatry and all of these things, which is terrific. We do have a few questions online, but before I pivot there, I'm curious if there's anybody in the room that might have a question regarding the presentation. Are you going to ask a question or are you trying to leave? That is not a well-being focused confrontation. Okay. Let me start with one of the questions that came in online. This is an acknowledgement that third place groups and so many community building wellness initiatives really do benefit people, particularly when those people can take time away from work, but it may also further strain people for whom there is not coverage or asking for coverage burdens colleagues. How do we address these disparities that those who may be most burned out can't participate in those wellness activities perhaps as readily as others?
Yeah, I think that's an important part of the conversation around not just encouraging folks to do it. And thankfully we did see a fair amount. I think we had about 6 groups go through it. I tried to do one. I think we met like once. It's hard. It's really hard to find that time. And so part of the shifting a culture is also finding ways to make time. And I've always emphasized that ideally these would be really during the workday, because that's showing that we're prioritizing making time, and that leadership is helping to prioritize that. And at the same time, folks say, I cannot do that. I don't want to do that. And so like my group was meeting at absurd breakfast hours that I don't typically get up for, but it's, really to listen to each other and what we need. So it can look a multitude of ways. And again, as we're building these things, everyone has various ways that flexibility looks in their day. And so I do hope too that people are co-collaborating and working with each other to find that space. So it's multiple people working together to do this, including leadership.
Yeah, I appreciate that. I also know there are parts of our department that are sort of chronically understaffed or having trouble just covering basics. So I was curious to know whether Stanford or other places that were doing similar initiatives had particular templates, let's say for inpatient or acute care teams, or those for whom coverage might be especially challenging.
The research that they've done, they've found that it's been, first of all, it's really only been done with MDs. And they were finding that it was particularly helpful to do it with administrative support to help people find time in their schedule. So we haven't taken that step necessarily. But other than that, I don't know about specific templates for, different work settings. And that can be something that we're really spearheading and thinking through.
Thank you.
I think this is a constant tension. So just to kind of name that, and it's hard to come up with a hard and fast rule on it, because for, some people, they want the time at work and they want the symbolic importance of that time at work, that this is important enough that it's during that work time. Others don't want their work day encroached upon and want to do it at a different time. And so I do think we've got to look at them, in each kind of what I would call micro environments, see what are kind of the barriers and the challenges facing that particular work group, and see if, we can find out something that really facilitates it for it happening there. And just generally, like when we set up Wellbeing Fellows, we did it 4 to 6. And a part of that was some symbolic too, right? Because people work different hours of the day. And for some people that might've been a terrible time, but the symbolic part of that was, I'll ask the leaders for an hour of their time and I'll ask you for an hour of your time. We'll try to kind of straddle that, but.
You're going to ask me personally for an hour of my time? Okay. Thank you. Thank you. Yes, Dr. Van Orden.
I just wanted to make a plug for the ice cream truck days. I love those. I think they're great. You just pop in. It doesn't take a ton of time. People can come when they want. Happy to do some sort of survey to see if it's effective so that we can support more ice cream days. So.
And just to be sensitive to those who have lactose intolerance, to ensure there are dairy-free options, potentially sugar-free. I'm just saying, we got to be, thank you. They do have sorbet. We do have another question here online. I appreciate the efforts to improve connection to increase fulfillment. I'm curious to hear what the university is doing to address the identified drivers of burnout, particularly increased workload, not enough time, but at an institutional level. beyond reducing the time for mandatories, which I do appreciate personally.
Mhm. I really think that's a driver of why my office is here. So, from connecting and supporting around, workflow improvements, things, like ambient AI, getting the mandatories pared down. There are a lot of folks trying to advance, each issue, and in each of those, of course, there are difficulties. But what I will say as a matter of kind of philosophical orientation of this office is that, we use wellness and well-being very intentionally and differently. And wellness are those plethora of services that we can pursue as individuals to feel better. And anything from, yoga to steps challenges to psychotherapy. And well-being are those efforts that we want to make to hold the organization accountable for workplace well-being. And so I think it is more balanced than it used to be. I think when wellness and well-being initiatives got started, they were all on kind of individual, go do all these things and make yourself more resilient. The point of the office is to hold the organization accountable to try to chase down those drivers of burnout.
Thank you. I also recognize you've only had this office for a year, so we do look forward to the vision that you outlined here, and I know you've got a lot of work ahead of you, so thank you for that.
Yeah.
Thank you. I'm just looking to see, yes, Dr. Cardella.
Hi, first of all, thank you for coming and talk with us about, it's nice to know that there's folks that are focused on well-being. One of the thoughts I had, and I don't know if this is just me, but I often have some great ideas about how to improve workflows, well-being, et cetera, and then I forget them by the time like people ask me. Is there anything like a suggestion box or some online form folks can submit if they have great ideas?
I don't want to steal the mic. Go for it. You can always email the office, and we're wellbeing@urmc.rochester.edu. Either of your reps here. So kind of in the meantime, but I am hoping to get to a more cogent, systematic way to be able to take those kind of ideas. So then a team of people can take a look at those.
Great.
If
Yeah,
we hear
and-
screams coming from the second floor, we'll know what's happening.
Every time I talk to, I'm looking around, seeing so many good ideas that have been generated by people in this room, and they come to me and they tell me, and it's like sort of chatter in the hall. And so one of my ideas that I thought about that hasn't been done is to have some type of suggestion box, because really you're the ones doing, that work in that micro environment. So, better than I would. So please tell us.
Great.
Yeah. Thank you.
Thanks.
Well, in the vein of excellent ideas, I'm going to share one more that came in the chat, and then we'll probably wind down for today. It was a suggestion for pet therapy to come to the outpatient clinics. We would love to see the dogs at team meetings. I would love a dog at a team meeting. Yes. Are you writing that down, Dr. Rooney?
I am. I'm writing it down.
Okay, great. We might need more pet therapy teams to just enhance the workforce of the pets. Yes. Okay. Well, with that, I will say thank you so much to our presenters for today. Thank you for all of you in the room and online. And we look forward to being well together. Thank you.
Thank you. Thanks for having me.